Hello, we are here today to present on the National and State Partnership to launch a new respite provider recruitment and training, training initiative. Next slide, please. And so for the agenda for today, my colleagues and I will be talking about, I will first be giving a project overview. And that is really just to lay the groundwork of the 3-year project. And then my colleagues will delve deeper into the specific recruitment and training initiative. So we'll have Jill Kagan from ARCH discuss the objectives and outcomes from the direct support training and the quarter competencies. We'll have Lisa Snyder from RCAW discuss recruitment strategies and data collection. And then we have a state example from Nadine Walter from Oklahoma, and she'll be talking about her experiences with the pilot. And then lastly, Kim Whitmore from Marquette University will discuss data analysis and the development of the report and toolkit. Next slide, please. And so again, here is the team and I. We're very excited to be presenting today. So then we have Jill Kagan. She's the director of the ARCH National Respite Network and Resource Center. We have Lisa Snyder, the executive director of the Respite Care Association of Wisconsin. Again, we have Kim Whitmore, the assistant professor at the College of Nursing at Marquette University. And then we have Nadine Walter, the program's administrator from the Oklahoma Department of Human Services. And then lastly, I'm Kimberly Hodges. I'm a policy associate at the National Academy for State Health Policy. Next slide, please. So to provide just the groundwork of this neat 3-year project is it's a collaboration between the National Academy for State Health Policy, ARCH, as well as the Respite Care Association of Wisconsin. And really our goal for this project is to support and foster state and national efforts, including those of the RAISE Advisory Council in promoting access to respite for family caregivers. Next slide, please. So there's 3 main objectives with this project. The first one, which again will be the main meat of this presentation today, is developing, testing, and scaling a respite workforce recruitment, training, and retention program. And then objective 2 and 3 is a huge component of what we do here at NASHB. And that is develop and field test a state-based framework and roadmap for respite system planning and development, which again will tie into the national caregiving strategy. And then the third aspect of this project is really looking into the natural supports of the service, as well as really testing those approaches to support family caregivers. Next slide, please. So again, today's presentation will mainly cover the recruitment and training pilot. And our overall goal, which we'll get into more detail, is to really improve the evidence base for respite care, as well as kind of really just seeing what the needs of the families that use the service are out there for. Next slide, please. And so I also wanted to share a few resources that we have developed at NASHB that ties into more of the outcome 2 and 3 of the project. For example, we published a RAISE Act state policy roadmap for family caregivers. It's a multi-section roadmap that ties into service and support, really a multifaceted view of how we can support family caregivers. And of course, respite is one avenue to that. So we talk a lot about that service in section 3A, the services and supports for family caregivers, as well as what sort of funding states can use to braid and blend in order to support caregivers. Next slide, please. And then just a very general perspective of another portion of the project. Again, we won't be getting into this today, but we will be publishing soon interactive 50-state maps that really delve deep into waiver and manage long-term care coverage of respite, and adult day, as well as looking at service utilization for those services. And we'll have that published on the NASHB website under the respite care tab. Next slide, please. And then I will pass it over to my colleague, Jill Kagan.
Thank you so much, Kim. I'm Jill Kagan, Director of the ARCH National Respite Network and Resource Center, and I'm going to introduce and provide an overview of the objective that Kim talked about, our collaborative project with NASHB, the Respite Provider Recruitment, Training, and Retention Pilot. And if you'd like to read more about the overall initiative, you can find information on the ARCH website at the link shown on this slide. For those of you who may not be familiar with ARCH, we are a national training and technical assistance center, and we provide information and support to just about anyone who's interested in finding, using, or providing respite. We offer training, evaluation, and research support through our publications, through webinars, and a national conference that are open to the general public. We also are able to provide assistance directly to family caregivers who are looking for respite through our National Respite Locator service, or by connecting caregivers to our nationwide network of state respite coalitions. Our National Respite Coalition is the policy division of ARCH through which we advocate for respite services in Congress. We're also funded by the U.S. Administration for Community Living to house the Lifespan Respite Technical Assistance and Research Center. And through this center, we offer training and support to state grantees of the Lifespan Respite Care Program and to their state respite coalition partners. Again, for those of you who may not be familiar with Lifespan Respite, it is a federal program that awards competitive grants to states to help them build coordinated statewide systems of respite care services that serve all ages and conditions. All of you are very much aware, I'm sure, and one of the reasons you might be interested in this session today, that we are in the midst of a long-standing direct care worker shortage that was fueled by the pandemic. And now it's rapidly escalating to a crisis, but many would say we're already in crisis mode because there just are not enough workers right now to provide home care, to provide personal care assistance, or even respite care. And we know that this is just going to get worse over the next 10 to 20 years due to rapidly changing demographics. Even today, more than 85% of the nation's family caregivers are not using respite. And one of the biggest barriers is their inability to find well-qualified providers. Fortunately, as Kim mentioned, addressing the workforce crisis and expanding respite options will be core components of the national strategy for family caregiver support that will soon be released through the Department of Health and Human Services and the RAISE Family Caregiving Advisory Council and the Advisory Council to support grandparents raising grandchildren. And we are really confident that the outcome of the work that we're doing right now will help inform the implementation of the strategy. As Kim said, the objective of our initiative is to test and eventually scale a respite workforce program through evidence-based training and recruitment strategies that will lead to an increase in the pool of well-trained respite providers to better meet families' respite needs. And at the heart of this initiative is an intervention that will employ a new competency-based entry-level respite provider training curriculum and a unique recruitment strategy that we are now field testing in 11 states. In addition to our NASHP partners, we're really proud to be working with the Respite Care Association of Wisconsin, which has been leading the effort in curriculum development for a long time now, as well as the novel recruitment strategies that we are implementing and testing. And then finally, Dr. Kim Whitmore from Marquette University, who is leading the evaluation of the field test. And you're going to hear from both of them in more detail in just a minute. We're in year 2 of the grant. And I just really quickly wanted to go through year 1, year 2, and year 3 activities to give you an overview. And then again, you'll hear more detail from my colleagues. But during year 1, we convened an expert work group to establish a set of core competencies specific to respite providers. And I'm going to be talking more about this in a minute. Those core competencies were then aligned with a long established and state recognized respite provider training from the Respite Care Association of Wisconsin. And while we were putting all of this in place, we disseminated an application nationwide seeking pilot sites that could field test the curriculum statewide and be in a position to recruit and reach potential respite providers who could serve family caregivers who were caring for individuals of any age or disability. And we went through a selection process and did select 11 states to participate in the field test. Again, Lisa and Kim are going to be delving into more depth on the states involved in the field test, which states those are and who are the leads, and on the activities in years 2 and 3 of the grant. But I just wanted to quickly give you an overview of the project's activities. In the second year, we've already completed work on developing the unique recruitment and marketing campaign. We've developed the survey instruments with the help of Kim Whitmore, and all 11 sites are now actively recruiting and training providers. During the final year of the grant, Kim Whitmore and in conjunction with the Respite Care Association, will be analyzing the data from the field test and then publishing a replication toolkit that will include important lessons learned. And we hope that at some point, this will be a training that can be available across the country. I wanted to just share a little bit more about the core competencies, because as far as we know from our research, they are the first ever nationally recognized core competencies that have been developed specifically for respite providers. I mentioned how we engaged an expert work group to help develop these competencies. Members of the expert work group included national experts on the direct care workforce from PHI, from Anchor, from the Elder Care Workforce Alliance. We had several state lifespan respite grantees and community-based respite providers on the work group, as well as family caregivers, including a representative from Family Voices. And with the help of Kim, our evaluation consultant, we conducted an environmental scan to identify core competencies that already existed, including the seminal work from the Centers for Medicare and Medicaid, their final core competency set for direct service workers that they released back in 2014. We also identified additional evidence-based frameworks that were developed by other national and state organizations, other government entities, and universities, specifically for training direct support professionals. And the expert work group helped us do a very extensive review of these core competencies and evidence-based frameworks. And from those, we agreed to a set of core competencies that would be very specific to training respite providers. And you can download these core competencies for respite care professionals from the ARCH website at the link you see on the slide. Some of the competencies that make them unique for respite providers include information on understanding the principles and value of respite for family caregivers and the people they care for, engaging in culturally relevant and meaningful activities with care recipients during respite time, and then finally making sure that anyone who was working in the field of respite had the tools to engage in their own self-care so that they could continue to provide respite. The respite care professional core competencies, as we call them, were submitted for public comment. We received over 200 comments, and they were evaluated and used to help further refine the core competencies to ensure their readability and usefulness. And these now nationally recognized core competencies were then used to enhance the existing and already well-established respite provider training curriculum from the Respite Care Association of Wisconsin. And each of the 10 courses in this enhanced curriculum meets at least one of the competencies. And you can also access a description of the 10 courses if you want to learn a little bit more about the specifics of the training on the ARCH website, again, at the link shown here. Of course, if you need more information and have any questions, this is my contact information, which I'm going to move through so quickly, you probably won't get any of it down, but I'd like to now hand it over to my colleague, Lisa Schneider at the Respite Care Association of Wisconsin.
Wonderful. Thanks, Jill. Hi, everybody. I'm Lisa Schneider, the Executive Director of Respite Care Association of Wisconsin. I'm also a family caregiver to my adult daughter, Kelsey. And I'm excited to share with you today information on our National Respite Recruitment Training and Retention Pilot Project. Next slide. Our National Pilot Project has a four-pronged strategy that involves recruitment, training, retention, and evaluation. I'll be touching mainly on training and recruitment in this presentation, as well as where we are progress-wise to date. As Jill talked about earlier, the purpose of this project is to really increase the number of trained respite care professionals and to improve the respite care professional recruitment and retention effort. Next slide, please. In order to select states to partner with us in this pilot project, we developed and issued an RFP for states to apply to participate in the pilot project. The RFP was focused on states' experience, capacity, and readiness to implement such a project. We originally planned on piloting this project with only 2 or 3 other states, but we were able to secure additional funds via NASHB and ACL so we could expand our pilot project to 11 states. We also established criteria with which to review each proposal. We had multiple national reviewers score the proposals, and 11 states were selected. Next slide. So these are our 11 state pilot project partners. We're thrilled to have such a great geographic representation. So here you can see we have Arkansas, Illinois, Kansas, Montana, Massachusetts, New Mexico, New York, Nevada, Oklahoma, South Carolina, and Wisconsin. Next slide, please. Our intent was to develop a national set of common core curriculum for training people to provide respite care. Once the new Common Core curriculum was established, based on the respite care professional core competencies, states were provided with slides where they could add their state-specific training requirements. Each state has its own portal access that is customized and branded to their own state information. Next slide, please. And click. The respite care provider training curriculum is designed for people who are interested in providing respite care to individuals with varying disabilities across the lifespan. Learners can work at their own pace to complete the 10 online courses that comprise the respite care provider training, stopping and starting as they need. Oh, and did I say there's no cost for this training? Very proud of that. Next slide. The training was designed to be an entry-level training program suitable for individuals and family members who have never provided respite before, as well as for people who currently provide respite but wanted to learn more. It was also intended to serve as a stepping stone to further a career path in the healthcare field. Next slide, please. And click. We worked with a national marketing consultant that specialized in recruiting and retaining direct support professionals. We held a series of workshops with all of the pilot project partners that focused on building your cloning machine. Who do we want to clone? Profiles were comprised based on real-life, high-caliber respite care workers, what their values were and what motivated them. Next slide. Then we focused on building our talent pipeline by identifying organizations, associations, businesses, schools, etc., that can become part of our talent pipeline and help us reach out to recruit those who we're trying to reach. People made lists and actually made contact with entities to ask for their help in recruiting by either sharing emails with their networks, posting flyers, putting things in newsletters, etc. This really helps spread the outreach exponentially. Next slide. We then learned about ways to overcome barriers in making these connections, building our talent pipeline, and identified steps and tools to use to build those pipelines. Don't give up after the first, second, or third try. Keep trying and to try different ways. Next slide. And lastly, we worked together to develop common marketing messages, tools, and methods of outreach, and identified minimum outreach recruitment efforts that all states would do on a weekly and monthly basis to build their pipelines and recruit talent. Next slide. We are currently in month 6 of our pilot project. However, most states didn't go live with their training until sometime in February. So on the left, you're going to see the minimum outreach efforts states are required to make in regards to our recruitment and marketing efforts. As you can see, states are exceeding expectations in some areas. In other areas, we need a little bit of focus. On the right side of the table, you will see the total numbers of learners who have created an account in the Talent LMS system and registered for the Intro Course 100. We use this as one of our marketing recruitment measures of connecting people with our marketing messages to even engage in the respite care training. This course provides information about the respite care provider training, the respite care professional core competencies, and an overview of the online training system. If people realize during this overview course that this training is not for them, they do not need to continue. However, if they do wish to continue, then they are enrolled in the course, in the 10 courses that comprise the respite care provider training. This is another unit of measure. Lastly, we track those who have completed the entire training course, which takes anywhere from 3 to 7 hours. People then receive a certificate of completion once they are done. We also have monthly check-in meetings with all of the pilot states to discuss where things are at and share how things are going, what's going well, what's not going so well, etc. Next slide, please. We also ask all of our pilot project partners to share their outreach efforts and marketing materials they've developed so we can see what each other is doing and learn from each other. We're trying to create a sense of synergy in that we are all working towards common goals. So here are some of the marketing materials that have been shared by other states. Next slide. So here's something from Arkansas. Next slide. Something from Illinois. Next slide. And here we have Kansas. Next slide. In Massachusetts. Next slide. Montana. Next slide. Nevada. Next slide. New Mexico. Next slide. New York. Next slide. South Carolina. Next slide. And lastly, Wisconsin. So that is a high-level overview of our pilot project partners in progress to date. So now I'm turning it over to you, Nadine.
Great. Thank you. Thank you to all those prior to me. We're so excited about this in Oklahoma, and I am Nadine Walter. I work for the Oklahoma Human Services. We are the state agency for community living, aging, and protective services. Under the protective services or community living, aging, and protective services, I also get to oversee the Oklahoma Family Caregiver Coalition, which is also OK Cares. Next. So maybe better give you an idea, and probably a lot of you state agencies can relate to this. I want to give you a little bit of a history of how we've built Oklahoma respite supports for family caregivers in Oklahoma. In 1997, a respite task force was put into play, and it was just a variety of state agencies came together to address respite needs of Oklahoma family caregivers across the lifespan. The vision was pretty simple. just to preserve and strengthen family caregivers' well-being and enhance care receivers' safety through increased availability and accessibility of respite services and supports. Next. In 1998, that task force became the Oklahoma Respite Resource Network. We called it ORN, and it went through about 2008. This included a variety of family caregivers across the lifespan, public and private agency advocacy groups. One of the things the family caregivers made very clear that they wanted the desire to select their own care providers. That was good news for the respite voucher programs at that time because they were really concerned about the liabilities issues related to, selecting private care providers. There were 7 state agencies that pooled their funding to provide respite vouchers. And Orrin received some really recognizable national recognition at various conferences. Next slide. Oklahoma was fortunate in 2009 to begin receiving the ACL National Lifespan Respite Grants. This was a big turning point for Oklahoma. We had a lot of groundwork done, a lot of things were in place, but here are some of the things that have been able to really evolve because of the Lifespan Respite Grants. I feel like we have a very robust respite voucher program. We provide typical vouchers for caregivers that fall between the cracks of our other voucher programs. These typical vouchers are $400 every 4 months. We have educational vouchers. We found that we as providers and other agencies can provide all kinds of wonderful events and conferences, but if the family caregiver has no support to watch their loved one so they can attend those events, we had wasted our time. So right now we provide for a half a day event, educational event, we provide a $50 voucher and a $100 voucher for those that are full day events. As we all know, caregivers run into emergency situations. So we have the emergency vouchers, and right now they are one-time $300 emergency vouchers. We're really proud of our Oklahoma Caregiver Coalition. We have 100-some private public partners that include family caregivers. This is a very active group. Every one of these individuals are on some sort of what we call a subcommittee to address special needs when they approach. We have several people involved on these subcommittees that we can call upon and address issues quickly. We provide an annual family caregiver conference. This has been virtually the last couple of years. We hope to go in person soon. Our next one is November 1st. Come join us. We'd love to have you. It's going to be a great virtual conference. In Oklahoma, we have a lot of siblings that are caring, raising their brothers and sisters with special needs. So SIP shops have become a program that is really taking off in Oklahoma to support those siblings of all ages that have brothers and sisters with special needs. Oklahoma also has a high incarceration rate. So we have a lot of grandparents and other relatives raising children. And these individuals take on these children in the middle of the night many times. There's usually more than one. And so we have partnered with the Department of Human Services with their relative safety plan to provide vouchers quickly to these grandparents and other relatives raising children, because if anybody needs them, these families truly do need respite. One of the things we're in the middle of developing is a respite app. In Oklahoma, we have about 7 respite voucher programs. As you can imagine, as a family caregiver, that's a little overwhelming when you want just respite. So we're developing the app to where they can go on this app, answer a few questions. It'll direct them to the appropriate respite voucher program. What we're excited to include this pilot is once they get to the respite voucher program, that's great. They have a voucher, but do they have someone to care for their loved one? If not, they will be directed to this respite provider registry. Next. There are challenges in providing respite, as we all know. Family caregivers want to be self-directed, and we so appreciate that and so want to honor that. So we do our best to help them with their self-directed respite opportunities. Family caregivers, as has been mentioned before, do not always have family or friends to care for loved ones when issued respite vouchers. Like Jill said, there's a lack of direct care workforce options. We're really strapped here in Oklahoma. Providers don't have a place to post their availability. I probably get a call at the state office once a month with a provider saying, I just want to help. How can I connect with these family caregivers? So this is really going to help us. As we all know, COVID-19 exacerbated challenges family caregivers were already facing in accessing respite. Next, please. So again, we were just, when this opportunity came, popped up in my emails, I'm already typing, we're in, and I'm so excited to have this opportunity because we knew we needed to have a respite provider registry. We knew that. We just didn't have the tools to really move forward. And this was such a great opportunity to partner with these great groups. Our goals were to improve access to respite care for family caregivers statewide across the lifespan. Training curriculum for respite providers and caregivers. We need the caregivers to understand what the providers are learning about so they have an idea, but we also need those caregivers to understand, how do you hire a respite provider? Where do I start? What are the things to consider? So we have a kind of a two-pronged training curriculum for providers and caregivers. We need to build, or want to build, an easily accessible provider workforce. So the caregivers, we want this as easy as possible for everybody. The marketing and recruitment campaign has been awesome. We have really enjoyed learning kind of how to break it down, recruit and campaign for providers and caregivers. It's not just getting providers in place, but the caregivers got to know that this is even out there. So again, we're looking at a big picture of this and really trying to recruit and market both providers and caregivers. One of the things I find always at the state office is that our elected officials need to know what we're doing. And many times, unfortunately, we do not do a good job of educating them. If they don't know, they can't help us, right? So this program will generate some really good data for us to show the importance and the cost savings of respite resources. Next. So bottom line, this pilot project, the caregivers, we hope in Oklahoma, will get on the respite voucher app, determine which voucher program they qualify. And if they don't have a provider, they can go to the respite registry, or maybe they have a provider, maybe they want somebody different. Here's an opportunity. On the flip side, the respite provider will have the registry to put themselves on, to market themselves and connect and match with the family caregiver. So again, respite provides healthy caregivers. That's our bottom line goal. Next. Real quick, we just have some marketing tools that we're really excited about. This is a flyer that we've generated. This one is more about just getting the word out to the caregivers and the providers. Go to the next slide, please. It gives more information about connecting with the caregivers, connecting with providers, who's going to be on the registry, how to learn more, who pays for the respite care. Then we also, next slide, have a flyer and a brochure, and this one's more for the respite care provider. So they have an understanding of what the training entails, where they can go, next slide, and answer some questions about, what is respite? How's this going to work? Just kind of reinforces the reason why we need them and want them and appreciate them to take the training. So that's Oklahoma in a nutshell. Again, we just feel so excited about having this opportunity. We wouldn't be this far without this pilot project being put in place. And we just are real excited. And we feel like in the next 2 or 3 months, we are really going to take off with this. We have the staff in place and everybody's ready to go. So please contact me if you have any questions or concerns at the state level of how we did this and maybe some other opportunities and funding we've used. Thank you. Kim?
Thank you, Nadine. Hi, everyone. I'm Kim Whitmore. I'm an assistant professor in the College of Nursing at Marquette University, and so happy to be able to be the evaluation consultant on this project. I'm going to talk a little bit about sort of bigger picture, what our evaluation plan is, and then share a little snapshot of some of the data to date, just to get you a little excited about how wonderful this project is going so far. So next slide, please. So our overall project outcomes are listed here. So we have really 7 big picture outcomes that we're trying to establish that we framed our evaluation plan on. The first is establishing the core competencies, which check, we did that, which is great. We also have already accomplished outcome 2, which is establishing the strategy for recruiting respite providers. Again, a really great innovative marketing strategy that was really fun to learn about myself as well. Outcome 3 was about improving individual knowledge and confidence in providing respite care. And I'm going to talk about how we're measuring that in just a minute. We also wanted to increase the number of trained respite providers, increase the number of people who join respite care registries if a state has one, some states don't, and then also increase the number of people who indicate that they have an intent to provide respite care. And then we're actually trying to measure the number of people who are actively providing respite care. And we'll talk about how we're gathering some of that data in just a minute. Next slide. So we have a multi-layered evaluation. So we are collecting data at the individual learner level as well as the agency level across all 11 pilot sites, and then rolling up that into an overall project evaluation. So I'm going to break down kind of what we're doing for evaluation at all 3 of those layers. Next slide, please. At the individual learner level, we have been able to build in some surveys right into the online training course, which has been really helpful. One of the surveys we have is our intro survey, and this survey asks pretty basic demographic questions, asks a little bit about their experience providing respite care, and then we ask them a series of confidence questions that are framed after those core competencies. So essentially we ask how confident do they feel related to each of those core competencies. We then, in the course itself, have a pre and post test, and these are more scenario-based questions that are aligned with each course objective and also the core competencies. So it's really a competency-based training aligned with those respite provider core competencies that we've talked about already in this presentation. And then at the end of the 10 course series, they are asked a post-completion survey question. So we again repeat those same confidence questions to look at the change in confidence across those core competencies. We also ask them to indicate their likelihood of providing respite care in the next 6 months. We ask them to identify what they feel might be some potential barriers to providing respite care. And then we have, of course, a general sort of satisfaction evaluation to get their feedback on how they felt the training program was and if they have ideas for how to improve it. Next slide. We have 2 additional surveys that we actually push out to learners. One is pushed out 6 months after they complete the full training program. And so what we do is we run a report from the system and then we email the survey out to them. We'll be sending our first surveys out next month. So we're really excited about that. We'll have some people who have completed this 6 months ago. And we're going to be asking them some very simple questions that help us understand if they're currently providing respite care 6 months after completing their training, and then to get their feedback on how well the training prepared them to provide respite care. So we're really excited to see some of that data. We also recognize that there are going to be people who start the training and maybe don't complete it for a variety of reasons. And so we wanted to try to capture some data on why people may have dropped out of the program or became inactive. And so we have started to send surveys out to those who have been inactive in the system for more than 21 days to ask them really simply with a 2-question survey, why haven't you completed the course? And if they have anything else they want to share about the course. So we have just started getting some of those responses back. I think we've gotten 6 back so far. And most of the people who have filled that out have said they either forgot about it or they didn't need it anymore. So we're excited to hear, more from people who, for whatever reason, didn't complete the course. And one of those I know said that they forgot about it and really wanted to still do it. So it's an opportunity for us to also remind them that they can continue the course and complete it as well. So if you go to the next slide, I'll share a little bit about our agency level evaluation. So I have the great opportunity to work as the evaluation consultant with each of the state sites in this pilot project. And we've already collected some data at baseline, so prior to actually launching the pilot project, to help understand what their individual state goals are, kind of what the potential barriers might be for their state, and help them really establish a baseline. We'll be beginning some 6-month conversations with states starting in July to really understand how things are going better, look at some of those metrics, which are listed on the right-hand side. So how many people have been enrolled, completed, joined the registry if applicable, and actively providing respite care from that survey that we're sending out. And so we'll share that data back with them for their state specific, but we really want to use that opportunity at 6 months to get some feedback on how it's going, what have been some challenges, what has been hard for them, what's working well, so that we can use that to continue to improve things as we go throughout the pilot. We'll be doing a similar conversation and evaluation at 12 months at the end of the pilot, and then 6 months after we complete the pilot, just to check in on how sustainability is going with the project as well. If you go to the next slide, you'll see that the overall project evaluation is developed based on the RE-AIM framework, which is a pretty common framework for project evaluation. And the goal of RE-AIM is to encourage everyone involved to really pay attention to essential program elements, including external validity that can improve the sustainable adoption and implementation of these effective evidence-based interventions, so our training program and the marketing and recruitment strategy. So if you go to the next slide, you'll see what RE-AIM stands for. And so this is really the type of questions that we're framing that more qualitative assessment on with our state pilots. So we're going to be talking to them about how well they're reaching their targeted population. Some states have really wanted to focus in on recruitment in rural communities, for example, whereas other states have really looked at trying to target the Latino community as a population where they really feel like they need more respite providers. And so states had the opportunity to identify if they had a targeted population, they wanted to tailor some of their recruitment efforts to. And so we'll check in on that. For effectiveness, this is really, how do I know the intervention is effective? And this really comes down to a lot of the learner level outcomes. So are people who are taking this training, developing more confidence and knowledge around being a respite provider, and are they putting that into practice by actually becoming a respite provider? The adoption level of this really looks at how organizations can harness organizational support and looks at some of those internal barriers and opportunities and how things are going. And then for implementation, we look at how the intervention or this training program and recruitment strategy is being delivered. So we want to try to have as much consistency across the pilot sites as possible, recognizing that each state has to do some adaptations to meet their state requirements and may have different target populations. But the idea is that we are measuring how well this is working across states so that we can eventually roll this into a national training program, which we're really excited about. And then the last level of the RE-AIM framework looks at maintenance. So this is really about the sustainability. It's, what are some of those things that are going to, allow us to continue this over the long term and know that this training has long-lasting impacts over time for building that pipeline of respite providers that are qualified and ready to provide high-quality respite. So on the next slide, you will see just a recap of what Jill mentioned earlier with our year 3 activities. So I want to spend just a moment to remind you and talk a little bit about kind of our plan for how we analyze this data and report out. So again, in year 3, we are going to be completing the field test, and we will be analyzing the results of all the data that we're collecting and completing our written evaluation report. We are doing monthly snapshot reports when we have our monthly meetings with the pilot sites to just give people an idea of how things are going month to month. And then quarterly, we have a more detailed report that we're pushing out that goes through a lot of the data that we get from those surveys that are built into the system. So we've already developed the Q1 report, and Q2 just ends today. So we'll be putting out Q2 report over the next couple weeks. And so we're excited to see the Q2 report data. And then when we are all done with this, as Jill alluded to earlier, we will be publishing an online replication toolkit with those lessons learned. And this is, I think, a really important piece of this project, because we are gathering and capturing, the how of all of this as we go along, but we are learning at the same time. And we're going to be using this evaluation and this pilot to share with others what we did, but also give recommendations for how this could be done better in the future as well. So we know that it's going well, but there's always opportunities to strengthen this. And so we're excited to be able to share that information and learning with other communities who may be interested in adapting this training for their states as well. So if you go to the next slide, I'm going to just share a little bit of a snapshot of our most recent monthly data report, so you can get a little bit of flavor of how this looks and where we are as the project is currently in at this point in time. So the next slide shows that we have over 1,200 people who have registered for the training, and this shows the breakdown by state. So as Lisa mentioned, some states got a little late start, so some of them didn't have a whole lot in January, February, but those numbers are growing as we go each month by month. And so in total, we have a significant number of people who have registered for this training, which again means they created an account and they started to take that intro course. If you go to the next slide, you'll see the number who have enrolled that's listed here by state and our total. So we've had over 700 people who've enrolled, and those are learners who completed that pre-survey at the end of course 100 and have actually enrolled and started taking those 10 courses that are part of the respite care provider training series. So we do lose some people from registering to enrollment, but we know that that's sometimes because people come in and realize this isn't for me, it's not applicable to me, and that's okay. So we're really excited to get people in and checking it out, because even if they don't end up enrolling, they may tell someone else about this. And so we think that even having people coming in and register is a good thing for our project as well. The next slide actually will show you the number who have completed this. So we've had about 250 people so far complete the 10 course series. And this is, again, people who have done both the 10 courses and they've completed the post test and the post survey. So if you look at the percentage completed to those who are enrolled, we're at about 35%. We'd like to see that get up to 50%. So that's one of our sort of goals, I think, for the overall project, is to get at least half the people who start this to finish it. Obviously, we'd love 100%, but that's probably not realistic. And we know that some people may take this because they're interested in a specific course or a specific section, and they may not want the full 10 course series, or it may be more than they need for the role that they're planning to play. But we're at 35% now, and we are seeing that number of completed is going up over time. So we're hoping that as efforts continue, we will continue to see a higher number of people that are completing the course once they're enrolled and registered and enrolled. So I believe the next slide, if you advance there, shows a few of the comments that we got. So we asked people to provide, any general additional comments they have about the training. And I just wanted to share a couple of these because I think it's nice to see what people are saying about the training course. The first one here says, "I've really enjoyed this training. I've gained so much knowledge from the respite care training." Another participant said, "This training was very informative. On one hand, I feel more confident about what my role would be as a respite provider. And on the other hand, I feel overwhelmed with what a big responsibility it would be." We've heard a lot of feedback on that anecdotally from folks as well, that they, really didn't understand all that was involved. And we're glad to have learned that information throughout this training course. And then the last comment here is, "I'm excited to learn from this program, something I am and a few things I was not aware of. I have an aging parent and a grandson with autism, and I'm eager to learn to take care of them myself." So we do have a good mix of people who are taking this as family caregivers to help in their role, as well as people who are looking for paid opportunities as respite providers. And then if you move on to the next slide, it is just a web link that you can take a snapshot of and look at our full Q1 report that is available. So that will give you access to a lot more data, breaking down our pre and post survey and the confidence levels in there as well. So if you're interested and you are a data nerd like I am, I encourage you to take a look at that evaluation report. We will be sharing more about this project, and we'll be much further along by September when we are presenting at the National Lifespan Respite Conference. And so I'm going to segue that back over to Jill, who's going to talk a little bit more about the conference. So thank you so much.
Thank you, everyone. That was really some wonderful information and wonderful presentations, and I hope you all enjoyed it. I know that from the data that we're gathering from this field test, we are going to learn so much about effective ways to recruit respite providers and train them and connect them to respite registries. And we're providing additional training and technical assistance to the pilot sites also about how to establish those respite registries. So that's a side component of this pilot as well. Before we close, I did want to be sure that you were all aware of the, as Kim said, the ARCH 2022 National Lifespan Respite Conference that will be held in Madison, Wisconsin, September 13th through the 15th. It's the first in-person conference we've had since 2019, so we're all very excited about it. And we're especially excited to be co-hosting this event with the Respite Care Association of Wisconsin. The theme is Reimagine Respite, and we're looking for it to provide an opportunity for us to explore what respite can be and what it can mean for family caregivers as we hopefully begin to emerge from the pandemic. And for those of you who are interested in these workforce issues, as Kim said, we are devoting an entire conference track to respite provider workforce issues that will include an update on where we are with this current respite workforce initiative. And it will also include many other innovative and emerging respite workforce issues and programs. So we hope that you all can join us. This last slide has our contact information. We hope that we will have the opportunity to be able to answer some questions from those of you who are able to view this presentation. In the meantime, if you have questions following this presentation and you'd like to engage with us further, please feel free to reach out to us at our email addresses here. And again, I want to thank all of our presenters. I want to thank Advancing States for inviting us to participate in the HCBS conference. And we hope that you all enjoyed this presentation. Thank you all, everyone, so much.